I chose to do my project on tobacco policy. We can start off with some background information. So, tobacco was America's first cash crop. John Rolfe is noted to be the first person to market tobacco and sell it worldwide. He started with his crop in Virginia and just sold it to neighboring colonies and then eventually to Europe. Tobacco is the cheapest stimulant, which also helps its market. The target groups for tobacco after the early 1900s were low-income families, women, young children, and companies distributed coupons to those target groups directly by mailing it to their home addresses. Some of these marketing tools included discounts on food with tobacco, their food stamps, and monetary financial incentives. There's a famous court case that I found while researching. It's called Loryard Tobacco Company versus Evans, and it basically explains a young girl that was introduced to Newport cigarettes at a young age of 13 in her developing years, and she became addicted to cigarettes, so that's causing her to have health failures and die from lung cancer due to her long-term use of the product. The economic impact and legislation that's currently in place for tobacco. So the United States is one of the top 4 tobacco producing countries in the world. The Affordable Care Act lets companies charge tobacco users more money as part of the 4 factors in which insurance premiums vary. The premiums can vary on age, geographic region, and family size as well. And this piece of legislation came into effect in January of 2014. Again, this allowed companies to charge up to 50% more based on tobacco use. The tobacco ratings for insurance companies. A tobacco rating, first, is the group that insurance companies put tobacco users in to separate them from the rest of their clients. The use of tobacco products can cause lung cancer, respiratory illness, throat cancer, and other ailments that shorten a user's lifespans. And this system was put in place to allow those users to have insurance rates that match the risks that they have to insurance companies, so that people that don't use tobacco won't also have those higher rates. And thus, this is making healthcare more unaffordable for tobacco users. More information on the ratings and insurance companies. So now users are quitting insurance instead of quitting the cigarette products, which is what the Affordable Care Act was supposed to help stop. So according to some studies that I researched, this surcharge made people less likely to quit even when the surcharge is lower than 50%. And people from that sample that were tobacco users said that they would not continue their current insurance policies within the coming years if their surcharges continue to increase. Therefore, the tobacco surcharges do not urge users to quit. The rise of e-cigarettes. As we know, like Juuls are more popular now. People use those instead of traditional cigarettes. So the Oxford Files on Nicotine and Tobacco research says that 43.9% of youth plan on smoking cigarettes after using e-cigarette products and vapes, and 21.9% of youth that had never used e-cigarettes planned on using traditional cigarettes in the future. So that will cause them to be at a high risk of becoming addicted to that nicotine in the tobacco products that they use, therefore putting them at risk for the surcharge on their health insurance in the future. And also I found that over 3.05 million high schoolers use Juul products. Now for the tobacco policy revisions. There is a rule provision on the ACA policy. It states that users have an opportunity to pay a lower surcharge at all, even if they prove to be enrolled in a program that will help them quit. Some parts of the therapy that will help them quit uses vapes or e-cigarettes, and they have to be careful of this because current users' programs insurance might categorize e-cigarettes and vapes as tobacco products, and if they do, then that doesn't count towards lowering your surcharge. Georgia's policy. Georgia does have a surcharge policy. To avoid the surcharge, some users became a part of the Georgia State Health Benefit Plan for cessation or quitting. This program began in 2005 and ended in 2011. Members of the program were not paying a surcharge for health insurance. There's not a lot of information about this policy, but I did find that there weren't any other programs with research like this in the country. If you want to know more information about this study, you can just refer back to my paper. Finally, the health implications and economic value for tobacco products in the U.S. and worldwide. So, a professor of health and economics in California says that after the widespread of banning smoking in public places, users still face respiratory diseases like those listed, and then users without health insurance still face depth in hospital bills and with serious illnesses. So, these costs impact users negatively, but puts more money back into the health industry to make it more profitable. So finally, in conclusion, tobacco is evolving. The youth is using e-cigarettes, and that could cause them to be more addicted to traditional cigarettes. Just touch back on the ACA legislation, which made it legal for insurance companies to allow tobacco ratings and users to be charged up to 50% more than customers that don't use tobacco products. And it's only proven that those users will opt out of health insurance and risk their lives. The American Lung Association suggested there are other ways to quit. Tobacco taxes, smoke-free laws, funding tobacco control programs, and making tobacco cessation treatment accessible. So that's all that I found in my research. I hope you guys learned a little bit more about the tobacco policy and what it can mean for people in our generation in the future.